All right. Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Carrie Reller, and today we have Ashleigh Gass as a very special guest. Welcome to the podcast.
Hello, thank you so much.
Yeah, I'm super excited to connect with you and talk with you today, as I know you are very close to me in the proximity in our Clearwater office. So, definitely a great networking opportunity for us. But why don't you tell us a little bit about who you are and what you do?
Yeah, for sure. So, Ashleigh Gass, I've been in the exercise phys arena for almost 30 years. I'm 46 years old, and my first course before getting into university, I was 18. So that's a bunch of decades ago. And just fast forward multiple years, I grew up in Canada and got to the States, did my master's degree in nutrition, then went in sort of the first half of my career was very strength and conditioning focused. I got really good at integrating calisthenics with strength and conditioning and was able to recover from very serious low back injury from integrating those two modalities. And then I was fortunate enough to co-own and found Move, which is a training facility. It's called Move Gymnastics-inspired strength training. And I've got a great group of coaches, and we specialize there in strength training, mobility, flexibility, and what was known as gymnastics-inspired strength training. So, and then I just really got deeply into the nutrition side probably 15 years ago and just did more and more training down that route. Fast forward till today, I'm a licensed dietitian nutritionist and did a year of training in functional medicine under the Chris Kresser Institute. And Chris Kresser was one of the original functional medicine guys dating back probably 20 years ago now. So I just kind of put it all together.
Yeah, I mean, you have a very impressive resume and lots of different like certifications and titles. And you even have a different vernacular, I noticed. Like you're like exercise phys, and that's not something that I hear every day from a different training background, but very, very cool. Also, you came from Canada, and what brought you to Tampa area?
At that time, business and boyfriend. I never heard of Clearwater. We were in California first for about 6 months, and then I had an opportunity to move across the country, and here we landed in Clearwater. It just wasn't hot enough in California.
Yeah, yeah, for sure. Oh man. And coming from Canada, you're probably melting here, but you have a very strong, obviously, fitness background. And what your gym is just such an interesting like integration of all these different types of training that you've done. And then also picking up the nutrition and functional medicine recently is, very amazing to complement it and put it all together. Tell us a little bit more about the Move, your gym Move, and what's the training philosophy? How does that stand out from a conventional gym?
So it's a good question. And it just kind of goes back to the origins of Move is that I went through, I mean, years and years of small back injuries, but led to a big one. And the only way I was able to recover from that after neurosurgery was to put together the missing links between traditional strength and conditioning, which is lifting a lot of heavy stuff with certainly some stretching and injury prevention work integrated into it. But at that time, there wasn't a huge amount of emphasis on like stretching and mobility. It was sort of an afterthought. So when I ran across Christopher Summer, he was the men's national gymnastics coach for like 40 years, men's national team. Him and Rob Wolf did an interview, and Rob Wolf is the original paleo guy. So they did an interview about back injuries. I heard that story and I just launched myself into the curriculum that Christopher had designed for adults, which was called Adult Gymnastics-Inspired Strength Training. So I just started to weave together the missing pieces of mobility, stretching, spine work, high level core work. So not just kind of like rolling around on the floor doing sit-ups, but more advanced and very clear progressions. And putting all that material together allowed my back to get really better, like not just symptomatically better, but MRI better. And this takes us back now to 2015. So what Move really is it's the byproduct of what I learned to get myself out of trouble and then applied to a lot of clients before Move was even a vision to get them out of trouble and doing well in their training. So it was just the difference really comes down to it can be very difficult to go to a training facility and find multiple training methods integrated into one system where you can go to classes and get strength training, stretching, and good mobility work without having to do it later or go somewhere else to stretch or go somewhere else to do your skill training. Because some adults, they want to learn how to tumble. They want to be able to do somersaults again. We've got adults that are doing back handsprings, and it's not an easy combination to come across. So that's really our difference. And then to kind of take it one step further is, in addition to classes, we have private training, and all of our members actually have access to their classes, their coach, and private training sessions. So it's just integrated on so many different levels. It's kind of your one-stop shop for training.
Mhm. Yeah, I mean, just I find that like some programs, like you were saying, like strength training programs or HIIT or something like that, they often leave out that stretching component, right? And that I guess mobility as well, because kind of goes a little bit hand in hand. And I think that some people, also neglect it because they don't want to make that time for it. So
Yeah.
how do you encourage individuals to see that that's super important in, their fitness journey, I guess?
With some people, it takes time, but so there's a few ways I'll answer that. Some people, it takes time and they have to experience doing it to go, oh, all right, my hips have been bothering me for the last 5 years, but after a month of training in this lower body stretch class series, my hips don't really hurt anymore and I can get on and off the floor easier. So usually folks figure it out for themselves based on an actual result. So there's folks that come to us and they're not sure. Then there's folks that actually seek us out because they're having issues and they're like, you know what, I can't touch my toes anymore. And I actually can't, if I were to get to the ground, I can't get back up again. That's the thing. Other folks, my shoulders are hurting and I can't just bench press and shoulder press anymore. So a lot of folks come to us, they know that they're missing something, but they're not really sure where to start. So we're in a different era than we were, I think, a decade ago, where folks are really well aware of this stuff, as opposed to 10 years ago. They're like, stretching, isn't that what people do in yoga? Like they just kind of poo-pooed it off to the side. And I really don't think people are doing that anymore. They get it. They're like, all right, if I can't move very well, what's the point in being crazy strong?
Yeah, I mean, I'm guilty of that as well. I feel like sometimes in the past I didn't do a good job making time for stretching. I'm
Yeah,
still maybe a little bit guilty, but doing better, doing
do
better.
better.
Yeah, and
Good.
I would definitely can relate to the hip thing, actually, like running more, and then my hips were bothering me, and then all of a sudden I started, doing more stretches and then not having that problem anymore. And voila,
There you go. I know and it's not that. Where do you train, if you don't mind me asking?
at home.
Oh, good. Okay.
Yeah. Yeah,
Yeah.
everything at home. My weights are, right behind me and everything. Yeah.
Okay.
The other thing you mentioned was like the patients, people, whatever clients you want to call them,
Yeah.
they are difficulty getting to the floor, touching their toes, and they have a hard time realizing how important this is, right? So we talk about like functional movements and things like that sometimes when I'm talking to someone like you, or just even with a patient, and just how critical, like, do you feel like those functional movements are to life? I mean, obviously you would know if you've had to, had injury or working with other patients too.
Yeah. Well, you just take those movements away and someone realizes really quickly how important they are. So
Mhm.
I think that's the fastest way to get someone to appreciate it, is to just take them away for half a day and just go, okay, well, for the next hour, here's the things you can't do. And
So
then,
I have, a lot of patients that we work with weight management and weight loss. And I think one I can remember in particular is always a great one for me, because she's had a great journey. I've been working with her a couple of years, but one of her things is that she's going to make herself get down to the floor and get up like every single day, so that she can, continue to do that like for the rest of her life. Like it's something that was a pain point for her, like difficulty
yeah.
getting off the floor, right? So now that's like saying I'm making myself get down there all, like multiple times a day actually, and get back up. And we do see a lot of older patients too who need these functional movements. Do you see any like clients that are older age that maybe lost some of these movements and help them
all
recover that?
all, all the time. And hats off to your gal who just, her method is just forcing herself to do it multiple times a day. That's hard way to do it. But congrats to her, because that's the hardcore discipline. I'm just going to force myself to do it every day, multiple times, until it gets easier. There's no gradients there. There's just like, do it. Like,
Yeah.
okay. So yeah,
I do think she had a gradient into but
okay. She did. That's very brave. Like, let's just get down. Yeah, we see people, and it's not just an old person thing. This affects folks that are of all age groups, because our lifestyles now, a lot of people are fairly sedentary, working over the course of the day, and it adds up. So Yeah, we have all age groups, all levels of progression and pain. Folks often avoid these movements because their knees are starting to get really, really sore. Their back doesn't move very well, so they're scared of rounding over. So we just have to figure out with everyone that comes in, and this is part of why we're not just to come in and sign up for your membership gym, because we know everybody there. We know their background, we know their injury history, and we know what we're working on with them at any given time. So yeah, people come with these things
Mm.
all the
Tell me
time.
about like a person who may have had like such a major quality of life improvement from working with you.
Well, that's a good question. We've got almost 150 Google reviews of sort of similar stories like that, but let me just see if I can bring one that really jumps out. I would say if I just go back over the last 6 months, Coach Jorge. So Jorge is director coaching, fantastic young man and really experienced coach, but he brought a guy on in his early 30s, lawyer, non-alcoholic fatty liver disease for sure, and really quality of life was getting bad. I mean, he was definitely obese, but just wasn't moving well. And we're talking about a 31-year-old, I recall.
Mhm.
So Jorge's turned him around completely, and we're not even working with him in the nutrition space formally. It's just chipping away at giving him little tidbits here and there. And Jorge, as his head coach, has brought him a long way. He can do split squats. He's doing upper body pulling movements. He's working on, believe it or not, I mean, he's working on skills like handstands. He's working on upper body strength. He's working on all of the stuff, and he's just doing so much better. He looks awesome, and he's really doing well. And he's not there 7 days a week for an hour at a time. He trains with Jorge once and then does a couple classes. We're 24-hour gym now, so he's got open card access. He can come in and do extra stuff on the weekend. So that's one story that jumps to mind over the last 3 months.
And I bet his metabolic health markers have totally improved as well. Yeah,
Yep. Yep.
absolutely. Yeah.
Yeah. So
That's awesome. So you said you weren't working with him nutritionally. What do you work with many of their clients nutritionally? And tell me more about that.
yeah, so nutrition is something that I used to do more on the sort of informal side. If we go back about 3 years, because where I had difficulty along the way was, as you know, nutrition can be very subjective, and I had trouble coaching that because the concept of teaching people to just eat, the word clean, I don't use that word a lot because it brings to mind all sorts of stuff. It isn't necessarily helpful. It took me a little while to wrap my head around systems, because when you're coaching someone, you've got to have systems to work with and clear benchmarks, and they've got to understand their numbers and their body composition start. Where are they going? How are they getting there? So when I figured that out, then I really started to dive into it. And I coach a number of people that are members at Move that were referred to me or just found us on social. And then I work with a number of folks that are across the state or across the country, and they're not training at Move. So it's sort of a mixed group of folks that are at Move and folks that are not at Move.
Yeah, so you're able to kind of do both things from like different platforms, basically. You're not necessarily working with them physically one-on-one in the gym, but you might be or something like that. Yeah.
Yeah, I'd step back from the hands-on physical side about probably 3.5 years ago, because when we first opened Move, of course, I did a lot of classes and the majority of the personal training, because Move was a continuity of the business that I already had, which was exclusively personal training with some classes that I taught out of a super small physical therapy space. So the evolution was we got moved to a place where we needed, because we didn't start off with a manager. We didn't start off with front desk. We didn't start off with any sort of like central control. The central control of the business was Ashleigh and her cell phone, basically. So as I brought more coaches on board, I was able to transition out of that into being fully on the business and running it and doing all the things. So I stepped out of the physical delivery side and then grew the business, got everything well systematized and stabilized, and then got back in the business on the nutrition side as that grew. So now I'm sort of a combination of in the business with all my nutrition folks, and then on the business from a CEO oversight standpoint as well.
Okay. So what would you say like functional nutrition means to you, and how does it differ from a conventional approach?
From a nutrition standpoint,
Yeah.
so and this is kind of goes back to what we were talking about before we started, is Peter Attia refers to it as medicine 2.0. So medicine 2.0 is the detection, and I don't even know if we can use the word detection. It's treating disease as it starts to really show up on labs or present strongly in symptoms. That's what medicine 2.0 got great at. That we have a procedure for it, we have a drug for it, we have a, hey, we got to watch this. Like, we have those protocols, and I think that that's what medicine got great at. But what medicine, and if we use the word medicine or nutrition, missed the boat on was what Peter calls medicine 3.0, which is longevity, early detection, keeping people as healthy as possible for as long as possible, and not just treating something as it shows up in labs, or not just kind of ignoring it until it's so elevated on labs or it's close to that cutoff point that you're like, hey, by the way, you're pre-diabetic, let's put you on a drug. Like, why didn't we say something 2 years ago? Like,
Really, it should be 10 years ago, right?
10
So
years ago.
that's part of the flaw in some of the lab tests that we do. Do you do any lab tests or anything like that?
Yes. Yeah,
You
I do
do. Oh,
labs. Yeah. I'll do labs. Sometimes, I mean, I tend to not be the one that's initiating them from like nothing. So usually people come to me and they have lab work that's been done. And so I'll look at it and I'll say, okay, well, what wasn't tested here was hemoglobin A1C wasn't tested, and we don't have a HSCRP. Those weren't tested. Can we get these done, please? And they'll just go back and get them done. Or sometimes in the case of thyroid, if I'm looking at that, the doc may have done TSH, but really nothing else, or TSH and T4, but we're missing T3. So then I'll send them back to their doctor with a list of, hey, can we get these other things done, please? So I keep it interactive with their doctor as much as possible, because I'm not a doctor. I know what I'm looking for and I know what I'd like to see, but I do like things to stay kind of in the hands of their MD and have the MD know that they're working with me and that I'm trying to help.
Okay. Yeah. I mean, I can't tell you how many times that I see patients who have been seeing another doctor and then they're new to me, and I run an A1C and nobody ever did. Sure, they got a fasting glucose that was fine, but guess what? A1C high every single time. I can't tell you, almost every day is multiple times a day. Prediabetes diagnosis because nobody ever pulled the A1C in the past.
Right. And why do you think that is?
Why? Oh, that is because insurance will not cover it, especially for Medicare things. So you have to say that there's like an abnormal lab result. So if they're getting normal fasting sugars, insurance won't cover the A1C, mostly in Medicare, but I do think more private insurers are, doing that, covering it now. But also the A1C is not all that old as of a test, right? I can't tell you the historical time of it, but it's not that old. So it's newer, and it's a measurement of, basically 3 months of an average glucose, computed to a number based upon the red blood cells life. So basically the red blood cells live about 3 months. So that's how we get it. And then, we do also not test fasting insulin, and that's mostly also due to because the lab test itself is not consistent. This is the argument that some people say, because the test isn't consistent across like different labs and depending upon when you do it, but it is still not a reason not to do it at all, right? So I do order it sometimes, but I'm always, telling the patient, hey, they may not cover this test for that one.
So if it's not covered, then fasting glucose was, say, 92, and you wanted to run an A1C. I mean, again, you kind of smiled because you're like, okay. And so if it's not covered, then does insurance just not run it, or do they then bill the patient for that marker?
They may bill the patient, and I don't know. There's stuff I do to help do my best to not have the patient billed. But yeah, I smiled obviously because, normal fasting glucose according to a lab is going to be less than 100, where we know that's really not an optimal range. Like usually we want to see that like 60 to 80 or so. So when I get them back from patients, I'm usually saying, hey, the lab reads this as normal, but I'm getting pretty picky. It may read normal, but this isn't optimal. So let's keep an eye on this or whatever, or tell them the same thing that I'm going to tell anybody who has prediabetes as well,
That's awesome. So, and this, again, just a question for you is, you have a really awesome approach to what you're doing. Why are you different? What have you decided to be different that the other MDs, a lot of them just go, everything's fine, see you next year? Like, is that a personal decision that you've made, or is it a result of your training, or both? Or why is that not the standard of care across the board?
That's a great question. I don't know. So some of it may be that, they're just following insurance guidelines. Some may be that they didn't, go the next step and educate themselves. I mean, I am board certified in obesity medicine as well. And we do I think there's some training in that when we get board certified in that it does say, hey, we're looking at labs a little bit closer. I would say it's just something that bothered me that we're missing diagnoses earlier, so I don't remember the exact thought process in my head, but went back to do extra training and constantly researching and looking at different ways and more specialized tests, although they're still not all necessarily included. But Quest is a nice, panel for cardiovascular risk that will get that HSCRP that you mentioned, and LP little a, and a bunch of little things,
Yeah.
and like the size of the LDL particles and stuff. So there's, more advanced testing, but if you're not actually doing what we call CME or continuing medical education, you're not really going to pick up on some of these things. And perhaps it's still not standard of care because insurance isn't covering it all.
Right. That would make the most sense, I think. Because I know
Yeah.
doctors are trying to do the right thing, but their hands are tied in a lot of directions. So it takes some guts to go off the beaten path and do what you're doing. It takes
Yeah.
more work and more like,
Yeah, it is.
okay.
I guess, yeah, more work. And, I try to also, when I'm dealing with weight, we're also trying to figure out if there's a medical cause of that. So I'm looking for insulin resistance. I'm looking for thyroid problems, right? So I will be doing that. But also when I do some of that, I'm always like, well, they may not cover this, but let's order this because I think this is important to, find out what's inhibiting you from weight loss or whatever the reason may be. Yeah.
That's great.
So tell me, back to you. So what are some of the common issues that you help clients with? Fatigue, inflammation, gut? What do you think?
Yeah, fatigue and symptoms related to undereating, I would say. So a lot of my folks are pretty hard charging people they're training, they're really trying. They're trying to lean out. They're trying to get back to feeling a certain way. They're going to the gym. They're trying to eat well. Like, they're not just kind of sitting around and lollygagging through life. And they come to me because they're like, I think I'm doing the right things, but it's not working. So let's have a talk. And I go, okay. And I tend to not make any decisions. Well, I don't make any decisions at all, actually, until I've had someone track for about a week inside of an app that I use. And I can get inside it. I can get inside everyone's app. I can see all their tracking. I can see all their pictures. And it becomes pretty obvious what's going on when I'm actually able to see what someone's doing. I don't want them to tell me about what they're eating. A little bit of information, sure, but I'm like, if I can't see it and you're not tracking it, it's sort of a conversation that we're both going to forget in the next 20
Mhm.
minutes. So that just reveals a lot to me. It reveals that someone's eating well beneath or a little bit beneath their resting metabolic rate, and they're training 4 days a week, and the training's high intensity. Okay, we know that that's not going to work for very long, and it's going to cause problems with sleep. It's going to cause problems with mood. It'll eventually cause some issues potentially with the thyroid and hormones. So I go after the biggest missing pieces first. And I get people, they come to Move. If they're at Move, if they're not, they'll get it done somewhere else. I get people to do an in-body scan because I want to see lean mass, fat mass, body fat percentage, BMR. I teach them what those numbers mean. And then I teach them how to go, okay, do you see what's missing based on your body comp data and what you're tracking? Granted, the tracking is as reliable as it can possibly be. And as you know, tracking is not perfect. So I teach people to see where their own missing links are. Because as soon as they see them, they're like, oh, shit, yeah, I'm under eating, like by a lot. Maybe that's why my workouts are getting harder and why I'm not recovering and why I'm kind of in pain a lot. And I feel like not well rested. And we just fix those little things week by week by week. And I can get someone feeling much better within a few weeks, typically, if that's the biggest thing. And if I'm getting nowhere and I have labs, I'll be like, okay, let's take a look here. Let's kind of adjust this here. And that's how I start. So I just start by finding the missing links, the weakest points, and addressing them based on that person's lifestyle and what they're able to do.
Yeah, I mean, everything is like you were saying is very individualized to the person, right?
Yep.
You can't have take it one blanket approach. So I think that's really good, teasing out what's going on with them. Yeah, and
Yep.
I'm assuming you have pretty good success working with them that way.
Yeah, I do. I love it. Yeah, I've worked with a lot of folks now, and I have on our site, I've got a lot of before and after, before, during pictures, because I work with people sometimes for long periods of time. So yeah, we have a lot of fun, and it's not like it's not demanding. There's no demanding protocols. People aren't thinking that they can't eat all these food groups. So I just kind of teach people you can really eat a lot of tremendous variety of food. You don't have to limit yourself, but here's what we need to add in first. There's a lot
Mhm.
of issues with protein deficiencies and absorption, as you know, absorption challenges. So, like, yeah, it's just teasing out what is going to make it work for that person for sure.
What would you say is like one nutritional myth that you like to bust with your clients?
Hmm. That carbohydrates cause fat gain,
Mm.
like just that carbs will make you fat. So, if you want to lose fat, you have to cut carbs.
So clearly, if you're working with people that are training a lot, they need to have carbohydrates on board. I
Yeah.
mean, I do follow or know a lot of people who do like keto lifestyle, so they may not agree, but I usually the most people that actually can sustain their nutrition plan, diet, whatever you want to call it, are not going to be keto anyway. So yeah, carbs are definitely an important component for training. Yeah.
Yeah, for sure. And
Yeah.
even to your point, I think that oftentimes people think they have to be in a category and it's going to be that way forever.
Mhm.
That's not that's actually very rarely the case, because say that you got someone who is pre-diabetic and they're insulin resistant, and you start them off on more of a keto approach, and say that in 6 months their labs have changed, they've lost lots of body fat, they're doing well, they're starting to train again. Well, then they probably won't stay in the keto camp.
Mhm.
They might go into the carbohydrate cycling camp, where they have more carbs on their training days and less carbs on days they're not training. And so they kind of weave out of a strict approach to something and they integrate other nutritional concepts. It's okay. You don't have to be, there's not this loyalty to one approach forever thing that you have to buy into. You can actually mix multiple methods together. It's okay to do that.
Yeah, I think that's a great point. I think I would totally agree with that. Sometimes I do really address like a lower carb approach with patients, especially if they're presenting with these insulin resistance issues. And then they don't have to stay like that forever, for sure. And I think even with different changes in life, right? Like maybe, menopause or things like that, right? You think about everything might not work the same, right? That's one of the biggest frustrations. I'm doing everything that I did before and it's not working. Well, guess what? It's time to learn something different and what's going to work for you now, right?
Yeah, and that's a big one to confront, and it's harder going through it, but I totally understand what you're saying with that. That's a tricky one as well, is yeah, okay, when you're in your late 40s and 50s, you have this concept of what you were and who you are that's sort of around the age of 35, 36. But all of a sudden we're not there anymore. How do you
Mhm.
adjust to that? It's tough.
Yeah, yeah. I mean, and everybody's going to be different. And they may have to try a few things before they're going to find what works really well for them. Yeah,
Yeah, exactly.
yeah.
And I have a question, and something that really bugs me, because GLPs are not they're not my arena. I understand there's probably some very good uses for them at certain times, but I have yet to come across a practitioner or a patient on them who is clear on the protocol to come off them, if there is one. Is there, or like, how are
Well,
these?
I would say there is not a protocol to come off of them because these medications were used with the study. The clinical trials showed, if you did come off of them, that they would have weight regain. So what the, I guess, pharmaceutical companies in the study show is that you're supposed to do it for life, but if you come off of it, you may have weight regain. So I find that very challenging. There are some patients I think that maybe do need it for life, right? But I also think if you're really doing the work with the full picture and in a comprehensive program rather than just getting it off online or some spa, then you may instill those habits that you need to survive, where you don't have to depend on the medication. I don't think using the medication is wrong. I use it plenty. I have plenty of patients that are doing fantastic on it, and it is like life changing for them,
Yeah.
and they are still maintaining muscle mass. They are not becoming sarcopenic. They are doing like excellent in other ways. Their metabolic markers are great. They've come off of every other medicine that they were on. So I mean, that's a big thing to say too, because it's really working on that emotional part of eating, where sometimes that's just something that hasn't ever been able to be treated like that way.
Right. Right.
So I mean, one of my fears in focusing on is trying to help support patients who are no longer going to have access to these medications, or who, didn't access it in the appropriate way or whatever, and then how to support them to make these lifestyle changes to move forward and maybe not need the medicine, or, like maybe they need it for a little bit and then they don't again. Like, I don't know. I think it's just an arena where there is no protocol, there's no set thing. We're just trying to learn, and everybody's learning at the same time. And we got to just find out what works best for each individual person.
Right, right. Yeah, no, that's a great answer. It's been a question that's been bothering me for a while, just because it's not my arena, but I work with some folks that are on them, which I think is fine. But I've just been wondering, okay, what's the end game here? Especially if someone gets their training right and their nutrition taken care of. What does happen if you titrate off of them? Is it a guaranteed rebound, or if you have everything under control, is your body like, okay, good, like we've homeostatic mechanisms are in place now, we're good? Like, I just don't know the answer to that. So,
And I don't think anybody does. So it's definitely going to be individualized, and every patient may be different.
okay.
We're not going to know, because I think some people could be okay, and some people may need it like weekly forever, and some people maybe they don't even need it weekly. Maybe it's monthly, maybe it's every 3 months, or they do a little bit or something like that. I don't know, but it's just, I think, a work in progress, and they have all these other new medications coming down the pipeline, some that are stronger, and it's just an exciting thing, but also a little nerve-wracking, because we don't know what's going to happen to patients as they were to lose coverage and things like that. And the hardest part is because it's just expensive, and the coverage
Right.
for it. So yeah,
Okay.
but definitely a hot topic for sure.
Yeah,
I
same
have
with
that conversation a lot.
yeah, same with the hormones. It's an area I'm starting
Yeah,
to understand more and more and more. And I'm a big Peter Attia fan, and his recent interview with Dr. Robin Rubin is fascinating. I've had it on repeat for 3 weeks now.
yeah, Dr. Rachel Rubin. Yeah,
Yes,
she's
sorry.
yeah,
Yes, yes,
yeah,
yes,
she's
yes.
fantastic. Yeah.
Yeah. And
Um,
I just I love what they're doing. And I obviously
yeah.
you're familiar. So
Yeah. Well, yes, I've actually taken her course. So she's publishing another
good.
course, which I think starts now, and you could, sign up if you wanted to.
Is that through the Swish website?
I don't think
Uh,
so. It's through her own. Yeah. I think it's
Okay,
Rachel Rubin, MD, or rachelrubin.com. Yeah.
I'll check it out. There's
I
a
would highly recommend it.
Okay,
Yeah.
good. Yeah, there's a course through Dutch that I've got on my radar as well, that I've registered for. But yes, I totally will. Yeah,
Mhm.
yeah. We're gonna
Yeah.
have fun. This is good.
Yeah. So yeah, I mean, we've done the menopause space is definitely very exciting right now too, but I've done a lot of recent episodes on that. So I think we're good for now on that.
Yeah, of
But
course.
any other like things you want to discuss before we, I guess, close up?
No, I just say I'm excited to hear you're taking new patients, and I have a couple referrals for you, even myself. But no, I would just say, for those of you that are out there hearing this, just keep doing the right thing, keep educating yourself, keep your training going, and just look for ways to sharpen up your nutrition. And that doesn't mean look for ways to eat less, just look for ways to include better quality food and supplementation into your diet. So it's just sort of like parting words.
That's really good advice. Include, better whole foods into your diet. Usually adding in is an excellent tactic that a lot of people need. So if people want to work with you or join the gym or anything, where can they find you?
Yeah, just movegst.com. And so S is in Sam, T is in Tom, movegst.com. You can Google us. We're really strong on Google, and we're on Hercules Avenue in Clearwater. So movegst.com. Instagram is Move Training Calisthenics. And then my own is just Ashleigh Gass.
Awesome. Well, thank you so much. We're going to include all that in the show notes, and everybody please find her on social media and everywhere she just said, and tune in next week for next week's episode. Take care.
Dr. Reller.